Our featured NIC Talk speaker is Chris Edell, Chief Executive Officer of Elevar. Mr. Edell's talk is titled Contact Sport: How Boomers Are Changing the Health Insurance Game. Ladies and gentlemen, Chris Edell.
As an entrepreneur in Silicon Valley, I have a love-hate relationship with Highway 101, which stretches from San Francisco all the way down past Palo Alto. I have a love-hate relationship with this highway because on one hand, the traffic is terrible, but on the other hand, when I drive down that highway, I look at all the corporate headquarters on both sides and can't help but get inspired by the futuristic-looking buildings and the innovations taking place in those buildings. Buildings oftentimes reflect or try to reflect the innovativeness or an element of a specific corporation. Yet one of the most beautiful, futuristic buildings that I've ever stepped foot inside is not a technology company. It's not even located in California. It's located in America's heartland. And it houses, it headquarters, a nonprofit health insurance company. At the front door of this specific building, there exists a mail slot. This mail slot is where members can drop off paper checks for paying their claims. Now, how is it that a building with a state-of-the-art security system that can rival the top casinos in Las Vegas and state-of-the-art technology still being used paper when they drop off checks? There's a real dichotomy there that's really confusing to understand. I asked my friend John. John is the CIO of this specific health plan, and he is a phenomenal chief executive at this organization, about these specific issues. And as a CIO of this specific health plan, he has a lot of issues that keep him up at night, not just about today, but about the tomorrow, the future of the health insurance industry. I asked him, what keeps you up at night? What are you concerned about as a CIO of a health insurance company? What he says to me in response is, what really concerns me is the baby boomer generation. And I can, on one hand, relate because I am a baby boomer, but looking at it from a health insurance executive perspective, there are some fundamental opportunities and challenges. First, let's look at some numbers. As of 2000, there were approximately 35 million Medicare-eligible Americans, 65 and up. By 2030, that number is projected to hit 75 million Americans. Today, there's approximately 300 million Americans in the United States, so assuming that ratio, approximately 1 out of every 4 Americans will be medically eligible, assuming that it's a steady state population. Let's talk about some of the good of the baby boomer generation. Overall, baby boomers are the most educated, wealthy, and diverse generation to date in US history. They represent 4 out of every 5 personal asset dollars. They represent the highest proportion of college degrees and countless nationalities, cultures, and languages. They, in comparison to the greatest generation, will also live longer than any other generation in history, expected to live approximately 3 years longer than the past generation. And then finally, despite perceptions, they are extremely digitally connected. Nearly 1 out of every 2 baby boomers has a smartphone device, and nearly 7 out of every 10 baby boomers has used a social media application such as Facebook or Twitter. Those statistics don't lie and really prove how digitally connected the baby boomer generation is. But let's look at some of the challenges of the baby boomer generation. It is anticipated that by the year 2050, nearly 1 in 3 baby boomers will have diabetes. Number 2, obesity. Nearly 1 out of every 2 baby boomers may be obese by the year 2050, which is an epidemic that hasn't really been encountered before from a public health standard. And then 3, even though baby boomers are living longer than any prior generation, they're visiting the hospital more to manage these chronic conditions, which is contributing greater costs to the overall healthcare system. Let's look at those costs. If you look at the average American in the United States from age 0 to 40, the amount of costs that they contribute to the healthcare system remain relatively consistent, somewhere between $1,000 and $4,000. But by the time you hit 65 years old, on average, you contribute nearly $10,000 a year to the healthcare system. And then by the time one hits their golden years at age 85, that nearly doubles again, almost to the price of a used automobile every single year to the healthcare system. With 75 million baby boomers expected to be Medicare eligible, you can see why John is very much concerned from a cost perspective. But what else keeps John up at night? And this is the thing that gets me really excited coming from Silicon Valley. It's the disruptors. This is a picture of the Google headquarters in Mountain View. And companies like Google are the cash cows for health insurance. They supply young, affluent employees who basically who love to have high-quality coverage for them and their families. But these are also the precise companies that are seeking new innovations to disrupt health insurance. For example, Google Ventures just recently invested an 8-figure sum into an emerging startup called Oscar Insurance, which is a digital health startup geared to rethinking about the entire personal experience for health insurance via mobile and digital devices. So why now? Why has health insurance faced this sort of disruption when in years past or decades past it hasn't had to deal with that? Well, one, with healthcare reform and the emergence of exchanges, there's been a renewed focus on the individual. In years past, health insurance companies only had to deal with employers on the assumption that a person would stick with an employer for decades. Now, it's completely common for a millennial or a Generation X or even a baby boomer to switch jobs multiple times in a given year. Two, the emergence of smartphones. Now you have a portable device that is customized to provide you your own personalized dashboards geared specifically to your preferences. Yet 1 out of every 5 health insurance companies doesn't have a mobile app. And then number 3, cross-industry expectations. If you think about your experiences in banking, with airlines, you can have a complete end-to-end digital experience on your mobile device without ever having to call customer service. You can check a bank statement, you can apply for a loan, you can check into a flight, you can switch a seat, you can request an upgrade, never having to call a single person. Why can't you do that with health insurance? At my company, Elevar, what we do is we try to bring together people like John with emerging startups from Silicon Valley to see what sort of innovations can help health insurance companies prepare for a new digital future. And I asked John, what specific needs are you looking for in health insurance to help ensure the sustainability of your company for the long term? He says to me, 1, we need real caregiver support tools. We know that nearly 50% of baby boomers fear that as years go on, they could potentially become a burden to their loved ones who are caring for them. Is there a way that we can create and innovative tools, digital tools, which can help caregivers manage these conditions for their loved ones and people they're caring for to make their lives easier? Because not only is that a moral imperative, but 2, having these baby boomers and the elderly not go to the hospital is fiscally responsible from our perspective. 2, medical advice tools. From a medical advice perspective, as you get older, the medical advice you get from your physician gets more and more complicated. And as it gets more complicated, you get older and that information gets harder and harder to understand. Is there a way that health insurance companies can invest in medical advice tools to help people understand what sort of medical advice they're being given in order to adhere to medical prescriptions, in order to follow doctors' instructions, in order to make their life and quality of life better? And at the same time, that reduces visits to the hospital and lowers overall healthcare costs. And then 3, a personally touching issue, is end-of-life planning tools. Nearly 3 out of every 10 people in the United States don't have a conversation with their doctor during their last year of life to discuss a future plan. And on top of that, there's approximately 30% of all Medicare dollars allocated to the last year of a patient's life. So is there an opportunity to develop end-of-life planning tools that make a person's experience during that last period better, and also can, in a way, help contribute to more sustainable costs in the healthcare system? We've seen some really unique innovations in Silicon Valley related to these innovations. For example, Uber for seniors. It's pretty much an Uber application where instead of getting a taxi via Uber, it sends over a transportation vehicle for a senior. This is an example of a caregiver tool that was invented by a 24-year-old that is gearing towards the baby boomer market. And this is a company that we've actually introduced to Wellmark Blue Cross Blue Shield, and they've been very interested in learning more about how such technologies can be applied to their specific innovations. There's also companies such as an avatar, almost a Siri for healthcare. Imagine being able to talk to your digital phone, and in similar fashion to Siri, instead of asking a question about directions, you can ask a question about, tell me my healthcare coverage, and if I go to the hospital or go to a doctor for this specific condition, am I covered by my health insurance? These are the unique innovations that are coming out of Silicon Valley and these entrepreneurial clusters that are really exciting and really, really get us excited about the future and how we can basically personalize the experience and make it better. So with that in mind, I wanted to thank everyone, and overall, there's a great opportunity for both millennials and baby boomers to work together to innovate amazing solutions for the baby boomer population to personalize the experience. Thank you.